This is part 2 of Nursing Informatics. Computers are vital to the functioning in our daily lives and are essential in healthcare. It is for this reason that a nurse must develop a set of core computer competencies or skills. These include a basic understanding of computer logic, data entry, data retrieval, information literacy, and troubleshooting basic hardware and software issues. I swear the first thing I do when I pick up a shift at the hospital is have to make sure all my computers are working and notify IT of the ones that are having issues. So learning how to do these things really is essential, even if you like computers or not. So computers are electronic devices with 4 main functions. Remembering that they're used for input, process, output, and storage is important. And, the capacity of them, you don't need to know the details of gigabytes and all of that, but it is important that you understand the main functions of a computer. Collectively, the operations of a computer are known as information processing or data processing, and we rely on them for communication, like emails, text, blogs, social networking, access to information, whether it's personal or business, education or general information, and business operations, which could be scheduling, purchasing, even education in that sense too. A key point is that the power of a computer is based on the speed, accuracy, and reliability, as well as the amount of data it can store while processing. Unless you're a nurse informaticist, you don't have to worry about that as much, but it is up to you to make sure that the equipment on your unit is functioning appropriately. Electronic communication in healthcare consists of the components listed on the slide. Let's talk about how each of these things is used within the healthcare settings we have observed. So the telephone, we have landlines, but we do have cell and internet phones available. Some of our clinical agencies have Vocera, which is like a cell phone for the in-hospital employees. We had talked at St. Joe's about getting cell phones that connected EMS to providers, to the nurses' stations, so that we could more accurately have an estimated time of arrival for codes, or have the vital signs downloaded and the description of the patient, rather than getting that phone call as they're on their way. The internet, we use those tools for staff scheduling, to work out patient flow, allow access to evidence-based references, policies and procedures, and staff education. Many hospitals have internal resources, like special internet pages of references specific to nursing. In many facilities, electronic mail or email is now the primary method for managers to communicate with staff. Email allows for rapid, simultaneous distribution of information and messaging to a large number of recipients. It's critical that these transmissions occur only on secure encrypted sites, because there's the potential for personal patient information. Also, it's becoming more and more an issue that we need to have really secure sites, because cyber attacks are becoming the norm. A listserv is an electronic mailing list that's an extension of the email. It's the most common mailing list application. The names and addresses of the people on the mailing list are called subscribers, and they're stored on a single server. So listservs are a powerful communication tool. The communication is global and instantaneous, and ideas and protocols can be shared, questions asked, answered, and surveys taken. This is a great way to get data, to share blogs, to keep up to date on what is happening. The only downside is that the listserv has everybody's contact information on one place, and so if there is a cyber attack, there's a problem with that. Then social networking allows people to connect interactively with others who have similar interests, and you guys know all about this. Telehealth is the use of telecommunication to send healthcare information between patients and professionals at different locations. It improves access to healthcare by providing long-distance clinical healthcare. Examples would be stroke, rural areas, cardiac monitors people wear at home, and now triage for 911, like I had mentioned before. And really, what a great time to discuss telehealth in light of COVID-19. I read an article just last night that more and more providers are utilizing telehealth as an option to primary care. This used to be an option for those services that were hard to access, especially in rural areas. But now we're seeing primary care providers really stepping up their use and then continuing an enhanced use for the specialty care providers because people are homebound or symptomatic, or we don't want them coming to a place to be seen. The benefits of computer-based tools for care are listed on the slide here. Tracking patients and equipment, managing staff, reducing errors, aiding patients with self-care, and educating nurses. Some facilities utilize GPS systems that allow real-time tracking. So we could use this if we had patients who wandered or in nursing homes. Some agencies use these real-time location systems or radio frequency identification detectors to locate patient care equipment that might be dispersed throughout a building. These systems save nurses time in locating the equipment, which would decrease costs of lost equipment. I'm thinking, how long have I searched for the bladder scanner, and what an amazing thing this would be, right? Other efficiency enhancing devices include the hands-free communication badges that I talked about, and then wireless smartphones that could be programmed with alerts from bedside equipment. I felt like we were big time when we were able to connect our IV pump into the call light so it would notify us that the IV pump was beeping. As far as managing staff and workflow, internet-based tools for staff scheduling, patient flow, evidence-based resources, policies and procedures, and staff education are excellent for increasing efficiency and convenience. I can't tell you the game change that happened when scheduling came online, where you could sign up, you could see who was working or who you might want to work with or might not want to work with. Tablets are efficient for bedside retrieval and documentation of patients' health information, the prescribed medications and interventions, and then test results in the electronic health record. Now I can get an AccuCheck recorded just by taking it at the bedside. I think it's great, but at the same time, it has made me not remember an AccuCheck beyond 2 seconds, so I'm always having to re-look at it. Reducing error with automation has been helpful too, because as healthcare becomes more complex, the opportunities for error has increased significantly. A hospital stay can be prolonged, or injury or even death can result from a seemingly simple mistake, like giving an incompatible medication or erroneously transcribing a medication order. And these things are things that can be decreased or limited with automation. There are different types of errors. We have errors of commission when the wrong action occurs, and errors of omission when the correct action doesn't occur. So overlooking a serious medication allergy, or failing to put the bed rails up for a confused patient. Also, we could have errors in planning or errors in execution. So we didn't do the intended action, or we took an action but it didn't go as it should have. The benefit of aiding patients in self-care. So I know at Kootenai Health, the patients have access to a TV that gives them specific education, and they have to do certain components of it to get more education or to be allowed access to the TV. And so also allowing people to access their own charts from different places is helpful. And then educating nurses. So there are many ways that computers assist nursing students in learning. We use the communication, online databases, and the internet. We can perform and document course assignments, clinical tasks, self-evaluation tasks, and then even simulation is a computer-based tool that we use for educating nurses. This slide is one example of how computers changed the world. So the picture of the doctor striking, and then there's an example of a chart that is handwritten by providers. Honestly, it used to take us quite a bit of time and human resources to figure out what a doctor was writing. So this is, it not only increased efficiency, but also safety, like reliability, right? So let's talk about different names of things, because an electronic healthcare record is different from an EMR or an EMAR. So an electronic healthcare record, or an EHR, is a longitudinal record of patient health information generated by one or more encounters in any care delivery setting. An EMR, or an electronic medical record, is one instance of care. So I'm going to have a consult for my pain in my foot, right, is on the EMR, which would go into the EHR. So the EHR includes the components listed on the slide in the picture, and it's a great representation of what goes into the electronic healthcare record. So think of how you utilize these components in the clinical setting. The electronic healthcare record lets you have access to the EMR, which is the electronic medication administration record, the labs, the H&P, all kinds of things. When did this patient come last, right? What were they seen for? What medications worked for them? All of that is found in the electronic healthcare record. The EHR standardizes languages and facilitates interoperability. Interoperability would be the ability of different kinds of computers and operating systems to exchange information with each other without losing the meaning of the information. So for that to happen, consistent languages are needed. These are computerized languages, but it's important that my CAT scan here in Lewiston can transmit to Sacred Heart or to a specialist in the Midwest, right? So just being able to transmit that content is makes it easy, safe, and affordable. The standardized language is using the same terms to describe a clinical condition in all the electronic health records. So it would allow comparisons of interventions and outcomes, which is necessary to utilize evidence-based practice to collect information for use across the board. Benefits of an EHR is that it improves efficiency, productivity, and continuity of care. A paperless health record conveniently stores all the patient information in one location. Some EHR systems are designed for planning as well as documenting care, so standardized care plans are incorporated into these systems. Also, there's applications that support efficient patient care workflow, coding for patient diagnoses and interventions, which would allow for accurate, convenient, and uniform billing. EHRs reduce redundancy, so allowing for secure and potential real-time sharing of patient information, which should reduce redundant tests. Improved accessibility means that various types of hardware support access to this patient information, like a stationary bedside terminal to a wireless laptop to a handheld device that the doctor could see the labs from wherever, right? And then clinical support tools. Electronic healthcare records equip providers with these support tools to access information and to assist with clinical decision making. So when your provider gets a lab back and wants to prescribe a medication, they can just directly find the appropriate dosing of that medication and the indications for using it. A huge benefit of the EHR is, like I talked about, is reducing errors with computer physician order entry. So it eliminates errors resulting from the illegible handwriting, and it makes the prescription process more efficient and for nursing and pharmacy by saving time and soliciting the information and then getting getting the actual prescription handwritten, or can it be transmitted? And then privacy. Access to sensitive patient information is limited to people with proper authorization in order to retrieve the data. The public health benefit is that the computerized records place data in repositories so the information can be sorted and analyzed to create information and knowledge necessary to support research and decision making, like we talked about. So here's a discussion for you. You are a Facebook friend with a nurse colleague, and note that the colleague posted a picture of a client's wound, along with a description of the client's health history and current problems. So you have to ask yourself, what should you do? What are the consequences of this posting to the nurse colleague? And what would happen if you did nothing? That seems obvious, though, to me. So how about we look at this question? You're a Facebook friend with a nurse colleague, and note that the colleague posted a picture of a client's wound. I feel like this is more reasonable because the other is like blatant disregard for privacy. But with this, maybe the client was just super impressed with a wound, because I can tell you there are super impressive wounds. But we, especially in this area, I know whose wound looks like what, right? If I'm in a healthcare setting. So now what do you do? I would say a wise rule of thumb is not to post anything on social media that you wouldn't want an employer to view. And it's not just about pictures, but it's about your personal life. And I will tell you, we do look at Facebook when we're making decisions about students, making tough decisions about students. These social media sources are good for real information about a person. But posting about patients is a significant risk for violating federal privacy laws, and the consequences of these are huge. So we need to make sure that we're following HIPAA policy, remembering that we can compromise patient privacy even without using a patient's name in a social network post. A picture of a wound, I'm sure a family member is a friend of a friend of a friend on your site, right? So you need to recommend to the person to take the post down. I would notify somebody that they should take something down if it was appropriate. But if you don't feel comfortable to do it, you need to get a nurse manager involved.